Hi everybody, in today's speech I will be arguing about why we should be teaching sex ed and making it a requirement or part of the curriculum in schools. So in an article by Dr. Bauer, Hammer, and Lenners, they said that we need to modify teaching sex ed into curriculum in classes because it helps change the light of societal norms. So having sex ed classes as a part of school curriculums will definitely be very helpful in making sure that the kids are informed and all the myths that they just hear from their other friends or all the misinformation that they have will be disregarded because they themselves will be taught about how to protect themselves correctly. With making sex ed a part of the curriculum, classes will be gender exclusive, so both the girls and guys would know what they are getting themselves into before engaging in such things, and there wouldn't be any type of embarrassment that could happen if they are both misinformed. With teaching sex ed in high school or any part of the curriculum, it is safer for the kids because this will teach protection and prevention of unplanned pregnancies. So this will teach the kids to use protections, which will help decrease teen pregnancy rate and lessen the rate of kids getting STDs. In CDC.org, they state that the ages from 15 to 24, 1 of 4 of those people are sexually active, and they are the 15 to 19-year-olds are the most high risk for contracting STDs such as chlamydia or HPV. They are the most high risk for obvious reasons. 15 to 19-year-olds are usually misinformed, or they don't have the right information or sometimes any information when it comes to engaging in sexual activities. In 2017 to 2018, CDC.org reported that there was an increase of 1.8% when it comes to getting STDs with the female 14 to 19-year-olds. Within the span of 4 years, the chlamydia cases for adolescent males went up by 32.8%. Those were the years of 2014 through 2018, according to CDC. The most prevalent STD that most 15 to 19-year-olds or the young adolescents contract is herpes, because you can contract this with just oral activities. So having them be informed with how to do STDs check would also be very helpful, because kids would know how to regularly get those tests, and they would be informed if they have any diseases that they might have caught from a partner. In an article by journal Adolescence of Health, they did some research and they came to the conclusion that telling kids to abstain from sexual activities or just forcing complete abstinence in their life just does not work. This does not stop them from engaging in sexual activities, and a lot of other research has also proven this statement. In a research done by the Iowa State University, they came to the conclusion that the low-income families tend to have higher birth rates because the families in those low-income communities tend to keep their babies versus the higher income communities. And with the research that they've done, they found out that in 1,000 people that they asked, 1 out of 4 people, 1 of 4 adolescents were engaging in sexual activities, and the age range that they did a research on was from ages 1 through 16, and the average for the boys was 12 years old, while the girls, it was around 13 to 14 years old. There are also many different kinds of contraceptives that we can take to prevent unplanned pregnancies, such as birth controls. According to PlannedParenthood.com, these are 91% effective if they are taken daily, which with these pills, you would have to take them on a daily basis. IUDs, which are inserted in your uterus, and these devices are 99% effective. Those two are the most common contraceptive used according to Planned Parenthood, and there's many more that the kids can be informed about when they have sex ed in their curriculums. I know that parents might feel like this is encouraging their kids to perform in such activities, but a lot of parents do feel uncomfortable and don't want to talk to their children about this. So having sex ed classes in school will take that pressure off the parents, because the kids will just be informed by their teachers, and from the classes that they would take, they wouldn't feel so awkward asking or talking to their parents about it. Fun fact, the Washington State also just approved and mandated sex ed in these classes, and these are what would happen or what would be taught in those certain age classes. And yes, parents do have the option to opt out if they don't feel comfortable enough for their kids to be in these classes, but this is a very good thing.